Don't jump.
Oh no, it looks like he's really injured.
Oh no, Gerald has suffered multiple injuries. Let's head over to the operating room and have my intern show you some anatomy terms.
Let's examine Gerald. It looks like he injured his right side of the body more than his left side of the body. To further our examination, we need to look at his appendicular skeleton, which is his arms and his legs, and his axial skeleton, which is right here, his head, neck, chest, and pelvic region. When we look at Gerald, we notice that his feet are inferior to his head, and his neck is inferior to his butt. And then, if we pick him up carefully, we notice that his stomach is anterior to his spine. It is posterior to his nose. When we look at Gerald more, we can tell that his eyes are medial to his ears, and his arms are lateral to his tongue. Good. All right, so let's look at him further. So his calf right here is distal to his hamstring, and his hip is proximal to his knee. And then his spleen, which is also in there, is deep to his ribs. Protect his lungs, actually. Let's assess the patient Gerald, but shh, don't tell the resident. So let's start off with his ventral cavity, which includes his thoracic cavity and his abdominal pelvic cavity. From my examination, I can see only minor injuries sustained to the thoracic cavity. However, some major injuries in the abdominal pelvic, which will need to be assessed later. Now, if we look at his dorsal cavity, which is in the back of his body, which includes cranial and his spinal cavity. These are the worst injuries that I have seen, and they are major life-threatening injuries.
Are you assessing the patient without me?
Uh-oh, here she comes. She's gonna assess some more.
I am Shelby Bougon, the resident that will be assessing Mr. Gerald here today. And I'm going to be working more on and focusing on the abdominal pelvic area cavity. And I will leave the dorsal cavity to one of my assistants. Let's lay him down and start assessing him. In order to further examine his injuries, we have to look deeper than just the quadrants, which are the upper left quadrant, the upper right quadrant, the lower right quadrant, and the lower left quadrant. Go. Let's make a cut on the transverse plane between the epigastric region and the umbilical region to further look into the stomach and the liver. Now that we know the stomach and liver have not been affected by the fall, let's look on to the bladder by making a cut across the sagittal plane between the hypogastric region Now that we know his bladder's okay, we need to keep an eye on the function of his kidney, which is located in the right lumbar region. By watching his urine.
Uh-oh, he's crashing.
Unfortunately, we lost a patient today. I'm going to bring in my intern, Celia, and she's going to talk about the autopsy.
To start off with the autopsy, I'm going to make a cut across the mid-sagittal plane so that we can look inside of his body more. First, I'm going to look at his spleen, which would be in the left lumbar region. It looks like there has been a big tear in his spleen that has caused him to bleed. When looking in the right iliac region, I can tell that from the fall has caused his appendix to burst, which is not good for the patient, which might have caused his death. Moments before his death, I realized that his stomach or his face had turned purple, which might have indicated something wrong with his lungs. So in order to get a deeper look, I'm going to make a cut across the frontal plane, which would be right here, to take a better look and look at his lungs and his right hypochondriac region and his left hypochondriac region. Unfortunately, from the fall, I can tell that one of his ribs had punctured his right lung, which ultimately led to his death.
Unfortunately, now it's time to tell Gerald's parents.
We are so sorry, but we lost Gerald.
Oh my God.